كنا بنتكلم عن المؤتمر وكنا هنروح نشوف تقرير. بس قبل ما نطلع نشوف التقرير، دلوقتي في جراح زي ما حضرتك قلت لي الاطباء بيعملوا العمليه دي لنفسهم. فدلوقتي هنشوف التقرير. احد اكبر الجراحين في جراحه السمنه والسكر عمل العمليه دي من 5 سنين، وهو بيحكي تجربته عن العمليه دي.
بروفيسور فوبي الجراح الامريكي المشهور في مجال جراحات السمنه والسكر، وده من اوائل الناس اللي حط قواعد جراحات السمنه من السبعينات. يعني احنا بنتكلم عن بدايه تاريخ جراحات السمنه والسكر. لان احنا التحويل المصغر للمعده بدا سنه 67 على يد بروفيسور ميسون وفوبي.
يعني كمان سنه كبير.
ده واحد بدا جراحات السمنه في العالم كله،
وعملها من 5 سنين.
من 5 سنين لما طلعت عمليه التحويل المصغر للمعده طلب من احد الجراحين الزملاء انه يجريها له.
فهو بيحكي
كمان عن تجربته في هذه العمليه.
طيب نروح نشوف. يلا نروح نشوف التقرير نرجع مره ثانيه.
You are one of the most famous experts all over the world. You have one of the creators of the bariatric and metabolic procedures. Discussing the issue of the new era of bariatric procedures and new era of metabolic procedures. We always know that diabetes controlled by medication, drugs and insulin, hypertension, hypercholesterolemia. The new era of metabolic surgery. What do you think about it, sir? And what do you think about the future of these procedures to control these known metabolic disorders?
Thank you very much for your kind comments. You know, we have always known that the procedures we do treat sleep apnea, diabetes, hypertension, polycystic ovarian disease, arthritis, and various other social conditions. It is just lately that the rest of the people are becoming aware of this. Now it has become acceptable. Bariatric surgery has become acceptable. And now we know that we're really performing what is called bariatric metabolic operations. That means metabolic operation is an operation that you perform on a normal organ to treat another entity. So what we're doing at this time, we're operating on the GI tract to treat other conditions. And the conditions range from diabetes to hypoventilation syndrome to sleep apnea to arthritis to hypertension. That's going to be the trend. It is just that it is difficult at this time for people to accept the idea of surgery. But it's about the best treatment for diabetes. I'll tell you personally, I had a gastric bypass to treat diabetes. And I had it on a Saturday, and my blood sugar was running around 150 to 170. And by Monday, my blood sugar had come down to less than 100, and it's been that way for more than 5 years. I also had sleep apnea, and that has disappeared for 5 years. I had difficulties getting around because of, arthritic problems, and that is the problem. So, it is the only entity that can treat 7 or 8 different things at the same time. The question now is, are they going to be accepted? We are caught in a situation where we're looking for an ideal operation. Remember that the benefit from this surgery varies. A 5% weight loss or no weight loss at all can fix some of the problems. For instance, if you have a diabetic with a BMI of 25, you may reverse the diabetes without any weight loss. There are some patients who are overweight, and with just 5% weight loss, you can treat a metabolic condition. And then there's some where you need 30%, 40% weight loss. It's a very complicated thing we don't quite understand. We appreciate it. We just hope that our colleagues would appreciate the fact that bariatric metabolic surgery should be an option in treating some of these conditions, particularly type 2 diabetes. Because type 2 diabetes has so many other complications. Not just the hyperinsulinemia, which results in the various vascular problems, the retinopathy, peripheral vascular disease, the cardiovascular disease. See, when you treat that diabetes, you prevent all these things. You prevent the amplification. So we're very happy that most of the world, especially when you start going to the Middle East, Asia, where about 2/3 of the people live.
Yes.
And where diabetes is very prevalent, people are getting exposed to it.